Hello, my name is Tierney, and today I will explain the process of how to complete an abdominal examination. You will first wash your hands, gather gloves, and a stethoscope and measuring tape. Start by explaining the examination to the patient, followed by asking questions such as any or current pain, nausea and or vomiting, changes in bowel movements, rectal bleeding, jaundice, abdominal distension, masses, pruritus, and change or loss of appetite. Then provide the patient with a gown and or sheet and ask them to undress and lie flat on the table on their back and place their arms to their side. The examination of the abdomen includes inspection, auscultation, percussion, and palpation. Please note that if the patient complains of abdominal pain, examine that area of pain last. If not, this will cause the abdominal muscles to tighten and cause the examination to be much more difficult. Be sure to always remember to examine from the patient's right side. Start by evaluating the patient's general appearance, respiratory rate, inspect the skin, hands, face, contour of the abdomen, and for the presence of hernias. Checking for any abnormalities. You want to assess for an inverted umbilicus. This can be a sign of increased abdominal pressure, usually from ascites, a large mass, or a hernia. Ask the patient to cough and inspect the inguinal, umbilical, and femoral areas. Coughing may produce a bulging of these areas, which may be related to a hernia. Or if the patient has had surgery in an abdominal area, there may be bulging along the abdominal scar of the incision site. In addition, if massive ecchymosis is present, that is a result of a hemorrhagic pancreatitis or strangulated bowels, called Gray-Turner sign. A Cullen sign is a bluish discoloration of the umbilicus. Next, you will auscultate the abdomen by evaluating the bowel sounds, listening to all 4 quadrants. Normal bowel sounds occur approximately every 5 to 10 seconds and are high-pitched. If after a total of 2 minutes, no bowel sounds are present, this is an abnormal finding and may suggest a paralytic ileus. Furthermore, then ruling out obstructive viscous abdominal bruits and peritoneal rubs. Obstructive viscous may be detected if succussion splashes are present in a distended abdomen as a result of presence of gas and fluid in the obstructed organ. This is assessed by placing the stethoscope over the patient's abdomen while shaking the patient's abdomen from side to side, remembering to do this if the patient presents with a distended abdomen. Peritoneal rubs are rough grunting sounds that you would hear upon auscultation as well. Then you perform percussion, which is used to demonstrate the presence of gaseous, distended, and fluid or solid masses. In the normal examination, usually only the size and location of the liver and spleen can be determined. You may palpate before percussion, especially if the patient complains of abdominal pain. However, either approach is correct. For the purpose of this video, percussion will be explained next. Percuss all 4 quadrants of the abdomen. Tympani is the most common percuss noted. Then percuss the upper border of the liver by placing hands over the right midclavicular line, starting in the mid-chest. Percuss downward. The chest sounds should become dull as the liver is reached. Note that the upper and lower borders of the liver should be no more than 4 inches apart. When assessing the spleen, note that it is often difficult to find. It typically lies hidden within the rib cage against the posterolateral wall of the abdominal cavity. Have the patient lie in a supine position, with the patient breathing normally. Percuss in the lowest intercostal space in the left anterior auxiliary line. Normal percussion yields either resonance or tympani. A positive test for splenomegaly is diagnosed when percussion is dull. If ascites is present, you will want to perform a special percussion test for shifting dullness to assess. Next, I will speak about palpitation, which is divided into 5 sections: light, deep, liver, spleen, and kidney palpations. Light palpations are used to detect tenderness and areas of muscular spasm or rigidity. Palpating the entire abdomen by using the flat part of your right hand or the pads of fingers, not the fingertips. The fingers should be together, and sudden jabs are to be avoided. The hand should be lifted from area to area instead of sliding over the abdominal wall. Always look at the patient's face during palpation to notice if the patient might be grimacing with pain. Deep palpation is used to determine the organ size as well as the presence of abnormal abdominal masses. Place the flat portion of the right hand on the patient's abdomen, and the left hand is placed over the right hand. The fingertips of the left hand exert the pressure, while the right hand should appreciate any tactile stimulation. Pressure should be applied to the abdomen gently but steadily. Instruct the client to breathe quietly through their mouth and to keep their arms at side. Again, be sure to look at the patient's face while palpating. In a patient with abdominal pain, rebound tenderness should be ruled out and is done by palpating deeply and slowly but quickly in abdominal areas away from the suspected area of local inflammation. If present, pain will be felt by the patient. Asking the patient which hurts more, now while pressing or now during release. Liver palpation is when you place the left hand posteriorly between the patient's right 12th rib and the iliac crest, laterally to the paraspinal muscles. Then place the right hand in the patient's right upper quadrant, parallel and lateral to the rectus muscle and below the area of the liver dullness. Instruct the patient to take a deep breath and press inward and upward with the right hand and pull upward with the left hand. Start as low as the pelvic brim and gradually work upward. To elicit hepatic tenderness, place the palm of the left hand over the patient's right upper quadrant and gently hit it with the ulnar surface of the fist of your right hand. Inflammatory processes involving the liver or gallbladder produce tenderness on fist palpation. During liver palpation, pain is elicited in the right upper quadrant during inspiration, and the patient suddenly stops inspiratory effort. This is called the Murphy sign. The hook method is also used to assess the liver, which you would then change your position and stand near the patient's head and place both hands together below the right costal margin and the area of dullness. To assess the spleen, you place the left hand over the patient's chest and evaluate the patient's left rib cage. Then the right hand is placed flat below the patient's left costal margin and press inward and upward towards the anterior axillary line. The left hand exerts an anterior force to displace the spleen anteriorly. Again, instructing the patient to take a deep breath as you examine, press inward with the right hand attempting to feel for the spleen as it descends during inspiration. The tip of the enlarged spleen will lift the finger of the right hand upward, then repeat on the opposite side. Please note that the spleen is not palpable underneath normal conditions. Kidney palpation is usually also not able to be palpated in an adult. Palpation of the right kidney is performed by deep palpations below the right costal margin. Still standing on the patient's right side and place his or her left hand behind the patient's right flank, between the costal margin and the iliac crest. The right hand is placed just below the patient's costal margin with the tip of the fingers pointed in the examiner's left. This is also done on the opposite side. In addition to abdominal examination, there are special tests as well. Ileocecal test for suspicion of intra-abdominal inflammation. The patient is asked to lie on the unaffected side and extend their other leg at the hip against resistance of your hand. A positive sign is abdominal pain with this maneuver. The arburator test, while the patient is lying on their back, you will then flex the patient's thigh at the hip with the patient's knee bent and rotate the legs internally and externally at the hip. If there is an inflammatory process adjacent to the arbitrary muscle, pain is elicited. This concludes the physical examination of the abdomen. Please note that normally a rectal examination is normally included in a routine abdominal examination. Thank you.